Do poor people have a right to family planning? It's an ongoing debate in the Philippines, where some 2 million pregnancies a year are unintended. Rosalina and Crisanto Boyonas, young parents of 6, can't afford another mouth to feed.
Some weeks we run out of rice, and I don't eat. I give my share to my children and to my husband so he can work.
Family planning has allowed Rosalina to return to school to learn skills she hopes will give her some income. She wants her 4 daughters to have better options than she had.
I always tell them not to start a family early like I did. Look at us. We are so many, and life is so hard.
Rosalina gets the pill for free. She is fortunate. Most public clinics cannot offer this support. After the United States stopped providing contraceptives to the Philippines in 2007, Manila failed to fill the supply gap. The last administration promoted only one form of family planning, the natural method, favored by the Catholic Church. Some members of the new Congress have introduced a bill that would require the government to provide a variety of modern contraceptive methods to local health services. President Noynoy Aquino, who took office in July 2010, has expressed support for this approach, drawing criticism from church leaders. Now Congress is debating the measure, which would also strengthen childbirth services and introduce sex education in schools. The bill's sponsor, Representative Edsel Lagman, supported a similar effort last year.
We think the 15th Congress will witness the final approval of this measure and the enactment of reproductive health policy, which is national in scope and adequately funded.
The church disapproves of pills, IUDs, and condoms, and opposes the bill. Joe Imbong is a lawyer for the Catholic Bishops' Conference of the Philippines.
The right to health should mean authentic health, not access to preparations and other artificial medicines that impair health or destroy the normal processes of the human body.
I think it's only in the Philippines where the church is vehemently against reproductive health and family planning. It's a wrong position.
Supporters say the bill would reduce abortions. Dr. Esperanza Cabral is a former health secretary.
It is estimated that we have anywhere from 560,000 to about 850,000 illegal abortions in the Philippines, and that really speaks to the need for contraception.
Church leaders disagree.
The more contraceptives are openly available, the more the failure rates will occur, and the more women probably will resort to unlawful devices in order to what they call terminate a pregnancy.
The government estimates that 11 Filipino women die every day from pregnancy or childbirth complications, including abortions. Family planning could reduce these deaths by 1/3, says Dr. Junice Malgar.
If you can help women prevent pregnancies, then they won't be exposed to the risk of pregnancy that kill them.
The average poor couple like Lucia and Mario Natabla have 2 children more than they planned.
We tried using the calendar method, but I was irregular, so it didn't work.
The Philippines' population has tripled since 1965. Many think it's time to make family planning a national priority.
Yes, I would like to see the new administration do that, provide information to families so that they can make good choices and provide them with commodities and services to exercise those choices.
This report was produced by William A. Ryan and Mark Westhoff and narrated by Cindy Bishop.